Hello everyone, my name is Pooja and I'm done my master's in medical microbiology. From the past 1.5 years, I've been associated with MyAussieTutor and providing and supporting students by delivering various online academic services. So today we'll be discussing a very interesting topic, which is telehealth model. So to begin with, we'll first introduce what does telehealth model means and how it ensures the safety of the people experiencing diabetes. As we know that diabetes is a chronic illness and is majorly and leading cause of individual health burden, especially among the Aboriginal community, because there are various factors and social determinants of health, including lack of education, poverty, lack of home, lack of income, and financial insecurity, all are contributing to the increased healthcare burden, in which diabetes is the leading cause of individual health burden. It triggers not only the health but also the long-term hospitalization and increased healthcare cost. So there is a need to design various specific models that will dissolve all the social determinants of health and can provide safety to the Aboriginal people who are experiencing diabetes. So many health delivery models have been introduced. Among them, telehealth model is a famous one and has proven various effective roles for supporting and encouraging the health of the people belonging to the Aboriginal community. So tailored telehealth technologies assist both the delivery of services and illness management. They will provide primary physician, health coach, personal trainer, physical therapist, nurse practitioner, nutritionist, physiotherapist. These all are the services that will be provided by the telehealth model. So next we'll discuss what does connected wellness mean and how it lead to an effective telehealth model. So it is a smartphone based application technology that has been used by various healthcare professionals for supporting and encouraging the people living in remote areas of Australia belonging to the Aboriginal community. It focuses on improved glucose regulation. It focuses on various parameters that can maintain the normal glucose levels among the people belonging to the Aboriginal community. It is linked with the smartphone self-monitoring coupled with health coaching. So it doesn't only support the glucose regulation parameters, but at the same time, it will guide and coach the patients to encourage and maintain a healthy lifestyle for supporting the overall well-being of the patient. So this telehealth model will also guide for safety, dietary control, and medication adherence, because medication adherence and maintaining a safe diet is also essential for the people who are experiencing diabetes, as this can directly fluctuate the glucose levels and can affect and increase the prevalence of diabetes. So this telepathy model will also guide the patients for safe dietary patterns, as well as provide various ways to adhere with the medication. They also provide diabetes control at modest cost for sustainable health benefits, because as we know that people belonging to the Aboriginal community are socially marginalized people and they live in poverty, and therefore they cannot afford higher healthcare costs as well as higher treatment cost for managing their diabetes. Therefore, this healthcare model known as connected wellness provide them services by remaining at the distance and providing online health and resources at a modest cost for sustainable health benefits. So we'll discuss this telehealth model with the help of a case study, and this is the patient profile that we will discuss in this slide. We'll discuss this based on ISBAR, which stands for ISBAR, and the full form is Identity, Situation, Background, Assessment, and Recommendation. So this patient named Mary is a 34 years old female who belongs to the Aboriginal and Torres Strait Islander community. She lives with her husband and 2 children in a rural town in Australia. She was diagnosed with diabetes type 2 mellitus, and she has gone through many admissions owing to imbalanced glucose levels, and she also had a medical history of stress and anxiety. she also complained, and this was a nursing assessment, she also complains of weight gain and loss of appetite, which is impacting her overall health, and she is not able to perform her everyday activities and making her dependent on others for her everyday activities. This also increased the healthcare burden and the psychological health burden as well. So for recommendation, she requires a multidisciplinary approach based on telehealth medicine that allows self-management, because self-management is a very essential part of maintaining diabetes by remaining at the home and performing everyday day-to-day activities. If this can be done by improving the social, economic, and environmental aspects of health. So in this way, the Mary can receive benefit and can maintain her diabetes. So moving to the next slide, we'll discuss suitability of this telehealth model, how this is going to be fit for this patient. As we know that smartphone-based management can save time and expense, improve the glucose control at a minimal price to extend the patient's time from outside treatment. This can also enhance glycemic control and improve patient while lowering healthcare cost, because it will lower the cost of hospitalization and long-term hospitalization, to be more specific, and also dissolve the cost of transportation to go to the hospital and pay hospital visits. So this can thereby enhance the glycemic control and improve patient while lowering the healthcare cost. The other common goals are exercise and a good diet for maintaining the normal levels of blood glucose. And these two aims, or we can say health goals, can be achieved by staying at the home, and this telehealth model is thereby suitable for the patient. The telehealth model, or the connected wellness, also guides the nurses to engage multidisciplinary team, which will guide the patient and guide her the cooking practices and exercise regime to ensure a safe and nutritious diet and exercise to balance the weight and appetite as well. So in this way, this telehealth model, known as connected wellness, was suitable for this patient. Why there is a need for multidisciplinary care need for this patient? As we know that diabetes is a chronic illness and can lead to unbalanced weight and diet, compromising everyday activities. Mary belongs to a lower economic background and therefore needs specialized care, because she belongs to a community where most of the people are being discriminated and unequal care is being provided based on their color, stigma, labeling, and their gender or ethnicity. So therefore the Mary belong to the Aboriginal community is having more specific care needs. So therefore the nurse must encourage and support multidisciplinary care needs for ensuring cultural competence by providing the effective healthcare services for the safety of the patient. To coordinate with health needs of the target population, a multidisciplinary approach model can be included. Physiotherapists, dietitians, social workers can be referred by the nurse, where a physiotherapist will design an exercise plan every day for about minimum of 30 minutes for the patient to maintain a balanced weight, and the dietitian will design a diet plan where a balanced diet will be designed and the patient will be able to manage her appetite and also leading to a balanced weight. And the social worker can support the patient to perform everyday activities and can also educate the patient to manage and self-manage the diabetes while remaining at the home. So therefore there was a need of multidisciplinary care need for supporting the patient to manage a balanced weight, appetite, leading towards a balanced or managed glucose levels in the body. So what are the benefits of this telehealth model? As we know that proper guidance and smart alarms from the healthcare model supported patients and ensured a safe adherence to safe medication. The patient will be switched on through online co-monitoring with multidisciplinary team, including physiotherapist, dietitian, and the social worker. Exercise monitoring, diet tracking through photojournals, personal trainer interaction, and self-generated insights will all part of the enjoyment and will be enjoyed by the patient, and thereby maintains a long-term engagement of the patient with this telehealth model. As we know that Mary emphasized the importance of self-monitoring blood sugar, diet, or activity changes. She is happy to modify her lifestyle and ensure a safe diet and exercise for managing her glucose levels, and thereby this telehealth model fits right for Mary. Patients like sending all of the data to the healthcare coach, scans, enlisting the help of a third party. So there will be a direct patient and the health professional interaction without the engagement of the third party, which can create limitations for the involvement of the patient in this model. So due to a direct coordination with the patient and the healthcare professional, this model will ensure a long-term engagement of the patient and thereby can provide them benefits and guide them on safe diet and exercise for managing the blood glucose levels. So there can be positive as well as negative aspects of this telehealth model. We'll discuss the positive aspects in this slide and the negative aspects in the further slide. So as we know that distance monitoring and consultation can dissolve the communication barrier. As most of the people belong to the Aboriginal community are limiting themselves for communicating directly with the healthcare professionals because they feel shy and are not able to communicate in English language. So this telehealth model will distance monitor the patient and consult them and thereby dissolve this communication barrier. And at the same time, this model is a cost-effective, real-time and accessible way of providing medical care, as well as expert the guidance and coach them by designing various education sessions and ensure that the same is being comprehended by the patient by taking continuous feedbacks. So provision of appropriate and timely healthcare and education services is also a positive aspect of this telehealth model. The connected wellness telehealth model will also focus on increasing the patient to physician ratio. So there can be, like, if there is a one patient, there is a specific healthcare profession or a physician that will be responding or responsible for that single patient. So it will also ensure or increase the patient to physician ratio. This is a very significant aspect of the telehealth model and can promote the health of individual Aboriginal people who are experiencing diabetes. Patient-centered solutions such as improved care efficiency are accessible through telehealth medicine. So what are the negative aspects of this telehealth model, which is connected wellness? Users cannot distinguish between pseudo alarms and accurate alarms because the Aboriginal people do not have enough education and lack the health literacy, and therefore they are not able to discriminate between the pseudo and the accurate alarms, and thereby this can create a healthcare gaps and can lead to disruption or limiting the use of this model by the Aboriginal people. Then this need for upgradation of software, which typically brings frustration among device users because they are not educated, so therefore they cannot upgrade or they do not have much information about this using the new software and upgrading the new software for the smooth running of the apps. So thereby this can create unnecessary frustration among the patient and thereby can limit the use of this application by the Aboriginal people. Very serious issue that most of the people or Aboriginal patients feel is the security and privacy risk that is associated with this digital information. This is a very serious issue as there can be a breach or leak of the healthcare or medical information of the people that can disrupt the autonomy and confidentiality of the people, and therefore they will limit themselves for using this application. So there from various positive aspects, there are various negative aspects that need to be considered while designing such kind of telehealth models. So to conclude, we can say that Telehealth model will include one-to-one health coaching and health services. This model is meant to offer encouragement and support to clients while also promoting healthy habits. This provides online and virtual healthcare services by just not improving the diabetes and maintaining glucose levels, but at the same time they will encourage and coach the patients how to maintain a healthy diet and exercise for maintaining normal blood glucose levels. So they will act as educators and educate the patient about improved health and the ways it can be achieved. It also ensures the engagement of multidisciplinary team for self-management, which in this case were the physiotherapist for designing exercise plans, dietitian for designing effective health plans, diet plans, and the social worker for educating the patient and providing home services for everyday work activities. This will increase overall health and safety of the patient. So we can say that these telehealth model, especially the connected wellness, shows a significant amount of interest for improving the overall health and well-being of the patient belonging to the Aboriginal community who lacks the basic access to healthcare and lacks transportation as well as financial abilities to reach out to the equal healthcare services. So at that time, point of care, these telehealth models will provide better healthcare services for improving the overall health of the Aboriginal people. So there are various positive aspects of the telehealth model, but at the same time there can be various negative health outcomes of this telehealth model which needs to be considered before designing such kind of telehealth models, and various recommendations can be taught by this presentation, like improved communication and security, safety of all the details of the patient health. So all these negative aspects can be resolved by upgrading the application so that it's increased long-term engagement with the patient, and its maximum use will be made by the Aboriginal patient living in the remote areas of the population. So overall we can say that telehealth models provide one-to-one health coaching for improving the overall health and well-being of the people belonging to the Aboriginal community. These are the resources and references that were used to design this presentation. Thank you and have a nice day.